Hi, it's Dr. Demestri, continuing on with my labiaplasty mini-series. So understandably, biggest concern in patients seeking a labiaplasty is this going to affect their pleasure in that area? And the answer is no. This is not something that should affect your sensation or your sexual function. So when we look at damage to the nerves and issues with pleasure after labiaplasty, it's typically due to a couple of things. So either you've had Mons liposuction done at the same time, so that's that hair-bearing area and is a risk factor for loss of sensation after labiaplasty. So I never do those two things combined. And the second thing is excessive use of heat. So you need to be really careful about not using heat in the labia area. So when we're operating on other areas of the body, we often use a cautery stick, which is basically like a blade, like a knife, that has heat attached. So it's simultaneously sealing off the little blood vessels and simultaneously controlling blood flow. Now, that blade emits a lot of heat to the surrounding areas. And so if you're using that in that really sensitive, delicate area of the labia, that heat can transmit to the nerves and damage them. So labiaplasty is best done with a cold technique, just scissor dissection. There's only a couple little blood vessels, and I use a different type of heat stick called a bipolar that confines the heat right in between the little pinchers and minimizes any spread to the surrounding areas. When you are doing clitoral repositioning, this is not often indicated or needed during a labiaplasty, but you just want to have someone who's very comfortable with that technique if they're actually looking to tuck in a protruding clitoris. Otherwise, if you're just getting the labia minora trimmed, just the skin procedure, there's been studies looking at the nerve pattern through the labia. They travel all the way up, and so you have retained sensation at the labial edges. It doesn't impact your clitoral sensation, and so all of my patients to date have reported normal sexual function following the labiaplasty and return to sexual activity around the 2-month mark. Have a great day.